Hi, my name is Tim Lee. I'm the Executive Director of the Texas Retired Teachers Association. Thank you for tuning in to watch this video. As you know, we tried to go live on Facebook and had a little bit of a technical issue, and we decided to record the presentation instead of troubleshoot audio while we were running live. So thank you for being patient. Today, I am so happy to welcome two friends and professionals who work with the teacher retirement system, Executive Director Brian Guthrie, and the health insurance. Tell us your title, Katrina.
Chief Healthcare Officer.
Chief Healthcare Officer, Katrina Daniel. And so we're very excited to have them here today and talk about health insurance questions that you have. And because we're not live, we're probably not going to be able to answer a lot of additional questions, but Katrina and Brian have both said they're going to monitor the comments from the presentation, and if we need to do additional follow-up, we certainly will. With that being said, let's go ahead and get started. Brian, I'm going to start talking not about health insurance, but some news that came out of the teacher retirement system about a week or so ago.
Sure.
Britt Harris, who's been the Chief Investment Officer over at TRS, is leaving.
He is.
And I think he's taking a new job with UT Investment Management. UTIMCO. So can you tell us a little about that?
Yes, absolutely. Britt's been with us for nearly a decade, and he let us know last month that he had accepted a new job with UTIMCO as our Chief Investment Officer. We were certainly very sad to receive that news. Britt's been just a huge asset to TRS over the past decade, and has really changed the culture in our investment management division, has brought a lot of positive changes to that group, and has made us a world-class model for investments in this space around the world. That being said, we wish Britt the best and wish him well. And I'm pleased to say that even prior to Britt making his announcement, that we had been thinking about a succession plan, because we knew this day would come. We just didn't expect it to come quite so quickly. But I've named his deputy as interim director. Jerry Albright is our interim CIO. And our board of trustees, who has the ultimate say in who the investment officer will be, is meeting a little later this month, July 13th. And will, I anticipate, take some action on naming a permanent replacement. So we expect a seamless transition and look forward to continuing to do great things for our members.
Yeah, great. Well, on behalf of all of the retired teachers and certainly our TRTA board and myself personally, please let Britt know that we really do appreciate all the work that he's put into, as you said, transforming what was already a great TRS investment model and almost taking it to another level. Mm-hmm. And just wonderful people that he has working at TRS and that you all been able to bring aboard. And we're very happy to know that he's going to find the right fit for him, but also to know that TRS has been very well served by someone who believes not just in making money for the retired teachers, but really working for them hard every day. And so we appreciate that. And we look forward to working with the next person that comes in and helps in that. So let's go ahead and start talking a little bit about health insurance. And we're going to cover a lot of topics today based on the questions that we've received in Facebook. And I'm going to go ahead and kind of just make a general overview. This is not necessarily a policy discussion. It's not really a discussion on kind of where we go from here. What we're more interested in right now is making sure that our viewers have the facts. And probably more than anything, the message that we want our viewers to have is that it is important to get all of the facts from TRS. And we're going to talk about communications opportunities. We are going to talk about phone numbers that you can call, a great website that you can visit. But as members in this plan, it is important that you get that information about your healthcare benefits from the people who have the information. TRTA is not qualified to help you make a healthcare decision. We need you to be communicating with TRS. We want to facilitate those discussions as much as possible, but these folks are the ones who are going to administer the plan. They have administered the plan, a lot of change, And before any decisions get made about what is best for you, we want to encourage you to continue to work with the professionals at TRS about what is best for you. So that being said, let's go ahead and start with some of these questions. And Brian and Katrina and I talked about this before we came on camera, and I'm going to ask the question, and I think the two of them are just going to answer it, and then we'll move on, and we'll have a good hour worth of discussion. So the first question that our members are interested in: what are the key changes TRS-Care participants are going to expect in their insurance come January 1st?
Well, thanks, Tim, and I certainly appreciate your opening remarks. We recognize that this is a period of just immense change for our members, but it was necessary change. Going into this legislative session, we all knew that the program, as it existed, was going to have to fundamentally change, otherwise it wasn't going to continue. And the legislature worked very hard coming up with a solution. We worked hand in hand with them, giving them the information they needed to make good policy choices. And although the final product may not be to everyone's satisfaction, I think it is an important step towards maintaining the solvency of a healthcare program for our members. So that being said, we have a number of changes that are looking ahead, going to take effect January 1st. Fundamentally, you can kind of break down those changes into three buckets, if you will. The first bucket is the legislature did add about $500 million in additional funding to prop up the program. But there are other policy changes that were made as well. And so the first bucket of changes really affect the pre-65 population. There will no longer be a menu of options for members to select from in the pre-65 pool. There will be a TRS-Care standard plan. There will be a premium associated with that plan. And there will be various benefit changes that members who are maybe in a high deductible plan currently will find familiar, but for those who are in TRS-Care 2 or 3 as they currently exist may not be familiar with. And Katrina will talk more about those in a moment. For our second bucket, or the third bucket actually, for our Medicare Advantage members, is the post-65, those who are eligible for Medicare. Medicare Advantage used to be an option. It is now the only coverage that's going to be available for our members in post-65. Otherwise, those benefits and the delivery of those benefits isn't going to materially change.
Yeah, and one question about that before, and maybe Katrina, you can add about this too. We get lots of questions about the folks that are over the age of 65, but maybe didn't change jobs after 1986, and so they didn't qualify. I think it's Medicare A, is that right?
That's right.
It's the non-Med A eligible individuals. So, but the new structure treats all over age 65 folks relatively equal with kind of the same premium and the same benefit model. And there's been a lot of discussion, and people who are in that camp, they know they didn't make that Medicare contribution. They're concerned that they may be losing their health care. So can we kind of, as we focus on the over 65s, can you address that a little bit?
Sure. As Brian mentioned, for anyone who is in that Medicare eligible population, so primarily the over 65 age group, we will only offer Medicare Advantage product for them. That means that everyone has to purchase Part B. That's the Medicare program that covers primarily doctors' visits and outpatient procedures. So there is a segment of the population that we serve who work for districts who may not have paid into the Medicare program, and so they don't have access to free Part A. For those folks, it's more important than ever that they purchase Part B, because that's what will allow them to participate in the Medicare Advantage plan that we're offering. And I'll say, and we can talk about this more in a minute, but the TRS-Care Medicare Advantage plan is a very rich Medicare Advantage plan compared to what's available on the market. So it's, I think it's valuable and important for members to purchase B, maintain their premiums, don't drop coverage, because that's basically your ticket into the Medicare Advantage plan.
Well, yes, there's a lot. We're going to unpack all those different levels as we keep going through this. because there are a lot of questions that, I can hear the retirees,
Right.
in my mind saying, what about this and what about this? So,
Right.
so let's focus a little bit on the under age 65 group in the high deductible plan. During the legislative session, I remember us talking about from the study that was done, it was just sort of referred to as the high deductible plan. And kind of the nomenclature of it is changing a little bit because we want to make sure that we're all talking about the same thing. And so I think it's being called TRS-Care Standard now, is that correct? Say. So can you please explain how the plan will work? Can you give us an example of any services that might be covered before meeting the deductible? Are there co-pays? I mean, this is very different. I think our members really want to know how the under age 65 standard plan is going to work.
Sure. Do you want me to take that
Yeah,
one?
please.
Okay, great. So as Brian mentioned, for our retirees who've been enrolled in TRS-Care 1, this will feel very familiar. In fact, the deductible for the new TRS-Care standard plan, the deductible is going to be even lower. It's been a challenge. We have not adjusted premiums for retirees in more than a decade. So the change in premiums, I think, feels very drastic, but our retirees have not experienced changes like many folks in the market have. And some retirees who are in TRS-Care 2 or 3 are likely even to experience a decrease in their premiums. So, so it'll be a single deductible plan at $3,000. You have to meet that deductible in order to, whether you're purchasing drugs or office visits or hospitalization, all of that has to go toward the deductible before the full benefit kicks in, and that the coverage will be at 80/20. So the plan would pay 80%. But to your point, there are some benefits that will be covered at $0. So preventive office visits, so your annual visit with your doctor, some preventive cancer screenings, flu shots, those things are covered without necessarily having to meet the deductible. So those benefits are available. And then we are also working on a benefit for prescription drugs, where we will offer for certain generic maintenance drugs for, say, hypertension or diabetes or conditions like that. We want to make sure that anyone managing those chronic conditions doesn't have the hurdle of meeting their deductible to make sure they take those drugs monthly, because it's more beneficial to the members and it's more beneficial to the plan if they stay healthy, manage those chronic conditions. So we want to offer that benefit at zero cost. I know you've gotten this question, we've gotten the question, what drugs are on the list?
Right.
We're working on that now.
Yeah. So this is kind of a theme that I think we may hear in some other parts of this as well, is that session went from January to June, and we had to know all of the components that the legislators were going to decide on before we could, a lot of this work could really, be underway. But it's being developed. There are some benefits to this that are not just tied to the deductible, as some of those well care visits and things that you mentioned, but we all just need to kind of be patient and let y'all get all that designed. And then I know we're going to talk about My TRS, and we're going to talk about communications with getting that information out, but TRS will develop some information that all participants will be able to get access to, that'll tell people this is what you can get that won't be part of the deductible, and when you visit your doctor with a well check. And so that's being developed.
Right.
Absolutely. We have a significant communication plan that we're just beginning to roll out. One of the benefits, and actually we were very clear with the legislature during the development process, asking for a January 1st implementation date to give us some additional time to get the information out about the changes. And so if everyone can just sit tight, we're going to start announcing very soon some meetings that we're going to have across the state, where members will have an opportunity to come visit not only with us, but with our providers, and with Humana, and with Aetna, and with CVS Caremark, in order to get all the information they need to make a good healthcare choice. And we really want to let our members know to, as you say, be patient. I know everyone's anxious, and we appreciate that anxiety. if you just give us some time to pull all this together and start getting the information out, we hope that you'll have the tools that you need to make a good choice.
Yeah. So, yeah, go ahead,
I
Katrina.
just would like to announce here
Yes.
that today, and we were hoping to do that live, but we just launched a redesigned healthcare webpage.
Oh, good.
On the TRS webpage. So if you go to the TRS homepage and click on the healthcare link, you'll go to a much neater, cleaner design. You can pick the population that you fall into, active care, non-Medicare or Medicare,
Great.
and then go straight to the information that you need. And then, as Brian mentioned, we'll be updating that as often as possible. And that is really going to be the place that retirees can get the most up-to-date information, the most accurate information is going to be on our website.
Great. Well, when we put this out there for everybody to be able to watch, we'll add that website into the description. Let's just continue to reiterate that message that the best place to get information is going to be the Teacher Retirement System's healthcare webpage that we're going to provide a direct link to and that anybody can get access to. But brand new site with lots of new information, I'm sure based on a lot of the feedback that you've been hearing and things that people have been asking. So that's great. I love that. So
And we'll still send mail out.
Yeah, we'll
as
have the
well.
traditional
Absolutely,
methods of
sure.
communicating with our members. There'll be written materials that will be sent out, and then, of course, anyone can always call in as well.
good. So just recapping this kind of subject matter, I'm under the age of 65. I'm retired now, and I'm moving into what we're calling the standard plan as of January 1st. So everything stays the same. If I'm retired and I'm in TRS-Care 1, 2, or 3 right now, that's all going to remain the same until the transition date of January 1st.
That's correct.
So
I do want to mention one change that retirees should look for.
Okay.
We are changing our pharmacy benefit manager effective September 1st for the TRS Care Standard Plan. So they can look for a new card. The benefits don't change. And as Brian mentioned, we're CVS Caremark will be our PBM going forward for our for TRS Care for the non-Medicare and Medicare Part D plan. They are one of the largest pharmacy benefit managers in the country. They have a very broad network. That's the option that we wanted to work with. And so members should notice very little disruption, but you should know that you're going to get a new card on for September 1st that will be CVS Caremark.
and that's for the prescription. So
Right.
if I'm not mistaken, hasn't that PBM, that pharmaceutical benefit manager, worked with TRS in the past?
We have.
That's right.
Yeah, so this is not because of the legislation necessarily. This is something that TRS looks at every few years and
We do.
tries to find savings. And so I remember one member asking that, does that mean that I can go into a CVS and have a script filled? But if I'm not mistaken, wasn't there a $10 additional fee or something on that benefit that if they went to a pharmacy and have it filled?
Yeah, so we had under, and this will be, again, we have the same benefits for the TRS Care, Care 1, 2, and 3. That will continue to January 1st, until January 1st. But there's a convenience fee associated with going to certain local pharmacies. But we have a Retail 90 network. Those are retail pharmacies that have agreed to mail order pricing. And so there are certain, so it's important, just like with your doctor, you want to make sure your doctor is in network. You also want to make sure you're going to a pharmacy that's in network. And that will save you the most money. And so making sure that you go to a Retail 90 pharmacy will be critical to getting the better copay.
Good. Well, again, just want to, on all the details that we talk about, I can remember bits and pieces, and I think our members remember a bit because they're using it. But if you ever have a more specific question, I think the answer of the day is we need to reach out to your team
That's
and
right.
kind of check kind of how to handle each of these situations. So,
And we have information on this website I was just talking about that clearly delineates what are the changes from January 1st going forward, and you can still access all the information about your current plan.
good.
And I just want to make one other comment about that. I know that many of our members have expressed frustration in the past about us seemingly changing pharmacy benefit managers every other year, and that's because we have.
Yeah.
But there's a reason behind that, and it's to save our members the most money. It's a very competitive marketplace, and every time that we go out for bid, we award a new contract, we're doing so with the promise that we're going to be saving additional dollars that will benefit our members.
Yeah, I know that you all have a really difficult and rewarding job in managing a $130 billion trust fund, and that's one thing. Managing healthcare market decisions are, in many ways, they're even more complicated just because of the continued changes both in federal policy and how the contracts are written, all the savings that are. So I know our members appreciate you all trying to save them the most money possible. Sometimes there's frustration because there's changes, but that's just one of the things that we know we have to deal with. That market is always changing. So we appreciate the work that you do to manage those costs. One of our members who's under the age of 65 has asked, what about setting up an HSA? And there's a lot of folks who ask us about an HSA. Can you talk about that component?
Absolutely. We do not have the authority to administer our own HSA plan for our members. But if a member has an existing HSA plan that they have through either their former employer or however they have set one up, they can use that to pay for their health care expenses under the new plan that's being modeled.
Okay. So I'm going to kind of wrap this up on the under 65. There's some things that we're going to learn. Y'all are working on the drug component. We're going to find out there's some benefits that we're not going to our retirees may be able to access without a cost, some of the well visits and things that you mentioned. About $200 a month for that premium. That deductible is $3,000. And generally speaking, your medical and your prescriptions are part of the deductible structure after January 1st. And we're going to wait for more information from y'all and how all that plan is going to be put together. But that's a good overview of what's going to happen.
And yes, and can I plug one added benefit that we put in that I think is going to be really important? We have added to TRS-Care, the standard plan, teledoc services. And if you've never used telemedicine, it's very convenient and much easier to use than you might think. Teledoc visits will be $40. So while that does count toward your deductible, it's a much lower cost and often much more convenient than scheduling an appointment with your doctor and going to the doctor. And you can open a session, visit with a doctor. They can call in a prescription to your pharmacy. It's very easy to use, very convenient, and I hope our members make good use of that benefit.
So we have a lot of members concerned about the Medicare Advantage plan. Many are just not familiar with how the Medicare Advantage plan works. A lot of that information comes from this difference between the TRS-Care Medicare Advantage plan and what it is versus the individual Medicare Advantage plan market. So let's talk about that for a minute, because it is a big difference. Brian, can you share with us some of those
Absolutely.
details?
And I understand there's a lot of bad information out there about Medicare Advantage plans and about what our plan is sort of put in that same bucket. And so there are providers out there that don't accept MA, or they believe that they're not going to get reimbursed the same amount as a provider, or the benefits are different. And our MA plan is very different from all of that. We've crafted it in a way to make sure that our members have access to any provider. As long as the provider accepts Medicare, they will accept and they can bill Humana. They can go to that doctor and receive benefits as if they were in network. And I think that's a big feature. The portability of this coverage is important. They don't have to go see one doctor in one limited practice because that's the only practice that will accept the MA plan. That's not the case with ours. As long as a doctor accepts Medicare and can bill us, the member will receive in-network benefits. The doctor will receive reimbursement without a reduction. So that's a very important component. The other thing to mention about our MA plan is that it comes with full prescription drug benefits. And so there's no need for supplemental coverage or anything like that. I think we addressed that earlier. Our MA plan is designed to provide a full menu of services to our members. And even though the premium may be higher than some of the other MA plans that are out there, that's why. It's because of the network that we're offering to our members, which is a very open network, and the benefits on top of it.
I think that there are more and more patients, and there seem to be fewer and fewer doctors. And a lot of times the docs' offices are stressed about all of the different kinds of plans that people may be bringing into their practice. But this is just so different, and it's one of the things that's really difficult to describe to a doc who may be inundated with all of these individual MA plans, and it's almost kind of an immediate put off, just armed up, we're not interested. But if our retiree members can sort of explain that, this is different, this is the TRS-Care plan, we're going to get a lot better, I think, service because of this. So, Katrina, I know you and I have talked about studying the claims that are coming into TRS, and so you all have some even more specific information about the Humana Medicare Advantage plans and the docs bill. Can you tell us about some of that?
Right. Tim, I think what happens sometimes is a retiree may call the doctor's office and say, do you accept Medicare Advantage? Or do you accept Humana Medicare Advantage? And the doctor's office says no. What they don't realize is that TRS-Care Medicare Advantage is different. Like Brian explained, it's a PPO product with an out-of-network benefit, whereas most products that you buy on the commercial market are an HMO. It's a health maintenance organization. It's a closed network. You must see the provider in the network, and there is no benefit outside of that network. That is not the case with TRS-Care Medicare Advantage, as Brian explained. And when there were discussions going on about should we move toward offering a Medicare Advantage only product for the Medicare eligible population, we went back and we worked with Humana. We looked at the not just the doctors that our Medicare Advantage members are seeing, but we looked at the doctors and providers that are our retirees that were in the standard plan. We looked at the doctors that they were seeing and did an overall analysis, and 96% of the doctors that our retirees are seeing are either already in the Humana network or are willing to bill Humana. And so for that other 4%, that doesn't mean that they would not bill Humana. It just means that they may not be aware that the TRS-Care Medicare Advantage program is different. And so I would encourage retirees, certainly they can try to explain that to the doctor's office, but if they don't make any headway there, to contact us. We or Humana can reach out to those providers and help them understand the unique nature of the TRS-Care Medicare Advantage plan and understand that they're going to get paid the same amount and the member's benefit is the same whether it's in network and out of network. And I also want to make the point that when you turn 65 or approaching 65, you start getting a lot of mail about insurance agents and brokers are trying to sell Medicare supplement products or Medicare Advantage products, and some of them are zero premium, or you may talk to your friends who have a zero premium Medicare Advantage plan. It's really important to look at the benefit structure and out-of-pocket expenses, and certainly the ability to access any Medicare doctor is not typically available in the market. So, and then there's the Part D drug piece as well. So what seems like a good deal may really not be a good deal.
Yeah, sometimes it just may not fit the needs. And again, we want to stress that as information is being developed and as y'all provide the information to the TRS retirees and the members on this issue, they have time to study this. They have time to ask questions. This is not something they have to make a decision on right now.
That's right.
Things are moving along just like they are, staying the course until we get to that January timeframe. So it's a lot to take in. It's a It's totally different than just about anything else really that you can go out there and buy. And so if you're wondering if this is still the best fit for you, the best people to really ask will be TRS and Humana, not a broker and not an insurance agent or somebody sending a flyer. And so we just want our retirees to make the best decision, talk to their docs. If there's a problem that comes up, I know we're going to probably hit on this again, but TRS and Humana may be able to help.
That's right.
So we talked about some phone numbers,
Right.
And we're going to put those in the description box and be able to let our members have those toll-free numbers. They can either call TRS with some specific questions, or if they want to reach out to Humana, then Humana can go to bat for them and call that, or do whatever that process is.
And it's a Humana number that's specific for TRS care.
Great. So let's talk about the mechanics of it, because there is a premium that's associated with the TRS-Care Medicare Advantage plan. There are premiums associated with Medicare. There have been deductibles that are connected to Medicare, and then there have been deductibles when under our current structure as well. So when this transition occurs, can you talk to us about the premiums that we're going to be paying, and then the deductibles that exist?
That's right. You want me to take that? Okay.
Please.
So do you want to cover the non-Medicare, Medicare, or both?
I'm going to let you answer it the best way you think.
Let's take Medicare right now,
Okay.
since that's what we've been talking about.
Yeah.
So the premium that's associated for the retiree, this is a retiree-only premium, will be $146 per month. In addition, as we talked about earlier, it's very important for the retiree to also purchase Part B, and that's about $134 right now.
Is that the monthly cost?
That's right.
Yep.
That's right. So that's your ticket into the Medicare Advantage, TRS-Care Medicare Advantage plan for those richer benefits. And then the benefit levels, the copays, are very much like the TRS-Care Medicare Advantage 2 that we have right now. So that was the model that we looked at, and that's it. So the copays that are associated with that plan structure are all that you have to pay. There are no other copays, co-insurances that you may read about with other Medicare supplements or the Medicare program. It's a single package in TRS-Care, Medicare Advantage, and Part D. All of the benefits are in that one plan.
Yeah. Well, so that's good. That's good. It's you pay the Medicare premium, you pay the TRS-Care premium, and that includes all the coverage plus the prescription component.
Right. Which includes the donut hole.
Great.
We cover that. That's
Yeah.
right. So for some folks who may be purchasing Part D on the commercial market, in the individual market, often there's a coverage gap, and TRS-Care covers that.
Yeah. And we can talk about dependent coverage in just a second, because that's really more or less a premium difference. A lot of the questions that we get every day are about this sounds good for me, but my dependent costs are going up higher, and that's true. I mean, those dependent costs are a little bit different. So I just didn't want anybody to think that the premium was $146 for the retiree and the dependent. Those costs
That's
are
right.
a little bit different.
That's a retiree-only
Yeah.
premium.
Okay, good.
And it's the most heavily subsidized in the plan.
Okay, so the deductible structure under the Medicare Advantage plan, is there a Medicare deductible that I have to meet and then a TRS Medicare Advantage deductible?
If you look at our benefit structure, we have all of this on the website. That is the plan structure. The deductibles, the co-insurance or co-pays, that's all you have to meet.
So Brian, I know prescription drug costs it's just a big portion of the cost of this plan. And we've been watching it for years, and we've kind of gotten to that point where it's almost 50-50 now, where you've got the cost of covering prescriptions is about 50% of the total cost plan versus just the medical cost, the claims to doctors and hospitals. So when we look at the plan, and I think I heard both of you say this earlier, for the over 65 population who have Medicare, there is a an actual prescription drug benefit that has a copay structure.
Yes.
And for the under 65, it's a co-insurance structure where once you hit your deductible, it takes it at 80/20. So
That's correct.
So
Except for that first dollar coverage that we talked about, that will cover certain generic maintenance drugs for certain chronic conditions.
At no cost.
right, thousands of people in this plan, and we're trying to answer lots of questions for everyone. So we're doing a general overview,
Right.
and I think the important thing is as you have specific questions or a doctor who you want to talk to, again, TRS has a phone number that you can contact TRS or you can contact Humana and find out more information.
Yeah.
That's right.
And one important thing about, and I know we're bouncing around a little bit, but for the pre-65 population and the deductible, the $3,000 deductible that they have to pay, all of their expenses, both for medical and for prescription drug costs, contribute towards meeting that $3,000 deductible. So there's not a separate deductible for medical care versus prescription drug coverage, and as is the case in some coverages that are offered, but that's not the case with us.
Yeah.
So all your expenses are going towards that $3,000 deductible, and
Okay.
then once you meet that, it goes to an 80/20
Good.
co-insurance.
Okay, well, let's tell us a little bit more about the coverage participants can expect using the Medicare Advantage plan. I think we covered a lot of this, but I'm over 65. I have the Medicare Advantage plan. We talked about doctor participation. You said TRS-Care 2. Some folks may not be very familiar with what that really is. Can you just give us the highlights of what that coverage is like?
Sure. There's I think the best source is to really probably look on our website, and we have a simple summary of the deductible and the co-insurance. So that's probably our co-pays, I'm sorry. That's probably the best place to go, but it's a relatively low deductible, and the co-pays are the same.
Yeah, I'd also encourage members to check out the website and look at some of the additional benefits that are offered through the Medicare Advantage plan. There really is an emphasis on preventative care in any MA plan, including ours. But there are programs like offering members free gym membership, for example.
Oh, right. Yes.
And so that they can take some of their preventative care into their own hands.
Right.
There's what we call a Well-Dine program that for members who have just been released from the hospital, having their meals delivered to their home after their hospital stay. There's a lot of neat little benefits like that members may not be familiar with or aware of, that we're going to do our best to communicate, but all the information is there if you look for it.
Good. Well, hopefully we can be a partner in continuing to focus on the benefit levels that you all have been able to work out for this group and that add a lot of value to this plan specifically. So glad you mentioned that.
And I'd like to point out, you and I have cooperated on a number of questions that you've gotten from retirees. We're getting the same questions. And so, again, to put another plug in for our website, we're going to have we currently have a frequently asked questions category, FAQ, where there's a pretty good chance if you're a retiree and you have a question, somebody else has had that question too. We're trying to organize the information to the best of our ability. We'll continue to refine it, but checking our FAQ will often cover a number of those specific questions that people have about programs, about plans.
Great. And I know that for our members who are watching this, if you have a question and you just don't really know where to get started, even if you don't see that answer in the frequently asked question, if you want to send an email to me at tim@trta.org, I am happy to work with Katrina and her team to get you the answer that you may need. And I may just be forwarding that on to you, but it just reinforces the point that our members have to get the information from the folks who know how the plan is structured. And I want to be as much help as I can be, and I know that our TRTA staff does too, but a lot of what we're doing is really just funneling it to y'all so that you can handle those questions, because we do not want to give the wrong answer. The right answer comes from TRS. It doesn't necessarily come from your friend or from someone else who says that was the answer they have. It's always important to check the answers from TRS.
And we have a team of counselors that are well trained and ready to answer questions and are happy to answer these questions.
Great. Well, I want to focus a little bit more on this doctor issue because I know that there is probably somebody typing a response, watching this and saying, my doctor says they will not take Humana or they will not take Medicare Advantage. So let's just very quickly touch on, if you're in that situation, what would you tell that member to do? What's the remedy of that situation?
Contact us.
Good.
Yep.
And let us know the doctor and give us as much information as you can to help us reach out to that individual provider and to educate them on how our product is different and why they should be accepting it.
Yeah. We all have little sayings that we kind of live by sometimes, and that is never take no from somebody who can't say yes. So TRS may be able to go to work for that retiree and communicate to that, or Humana. They may find out it's just a little bit of a miscommunication. And so let's get the answer from the people who really can do something about it. And
Absolutely.
While it may not be that every situation can be resolved, a lot of them can be if we just are communicating with each other, especially through you
Right.
folks.
I will say this, that anecdotally, just since the legislature passed the bill that addressed these issues, I myself have been involved in a handful of conversations with physicians or physicians' offices around the state, and I have yet to encounter a single doctor who ultimately said no.
Mm-hmm. Yeah. Well, that's good news because we can try to resolve all the ones that we can. That's probably the single biggest pain point that the retiree is facing right now is the uncertainty that their doctor will want to participate in this plan or work with Humana. And it's not Humana. I remember that we had this discussion
Same issue
about
with Aetna.
Medicare Advantage with Aetna. And doctors, we just need to go through the steps to bring those docs and those providers on board. And we may find out they're already on board, and maybe they, because there's so many of these plans, they may
Right.
just not know it.
We've
Right.
talked about this a couple of times already, but I really do think the biggest source of confusion comes around the fact that our TRS-Care Medicare Advantage program is very different than what's out in the market. And there are a lot more people who have coverage under other Medicare Advantage plans than have the special sort of coverage that we have cultivated.
Good. Well, let's focus a little bit more on this communications discussion that you all have kind of alluded to, and I know you've talked to your board members about it as well. So can you tell us a little bit about TRS plans for announcing these insurance changes to all the participants? I've heard that TRS is going to be hosting these informational sessions around the state. And so can you tell us a little bit more about what's going on with that, Brian?
Yeah, absolutely. We're working real hard now to come up with finalizing the dates. We plan to start having these in-person information sessions around the state in October. And we're going to hit all the major population centers. We're going to hit all of their TRTA regional meetings. That's always a good place to get the information out. We intend to have a couple of, we may even have a couple of meetings that are broadcast on Facebook or just communicating out to our members so that if someone can't attend an in-person session, they can go somewhere and see a video of a session that took place. And we're going to try to structure the sessions in a way that are very member-friendly, because we know that we have members that are in unique situations. They may have one member of the household who's Medicare eligible and another one who's under the age of 65. And so we're going to try to structure these. They're going to be a day-long session. The morning will probably be dedicated to perhaps the pre-65, and the afternoon dedicated to the Medicare Advantage plan, with a middle session just on prescription drug coverage, or we'll flip it. And so we'll post all that information in advance so that if someone just wants to come for their unique piece, they can, or if they want to stay for the whole day, that's an option too. And like I said, we don't have the dates specifically yet, but we hope to have those soon. And once we do, we'll post it on our website. We'll be sending it out in the mail. And sending out invitations to our members, letting them know that we're going to have an information session in their part of the state and at what time and date.
Well, I know that you're still finalizing a lot of those details. We've got a special session coming up, so that may have thrown off the schedule a little bit. But we have a broad network of communication as well. So as you all finalize those dates, please let us know, and we'll publicize them too. If we can provide any assistance, I know we want to help as much as possible, because again, we just come back to this main point. When you're just looking at this from the practical implementation standpoint, people need information from you folks, and we want to help get them there so they have the right information about the changes to the health insurance program.
Absolutely, and just like we've done in past, I mentioned the TRTA regional meetings, and I know that a lot of we always reach out to your members and our members through those meetings, and we have someone that goes from TRS. We also always try to have a table set up with, Humana or Aetna or whomever our provider is, and that's going to be the case this time too. So we're going to make sure that we have a lot of information available to members whatever venue they decide to attend.
Okay, good. Katrina?
I also wanted to mention that we'll be sending mail out to our members announcing the changes. We're finalizing a letter to communicate to members that'll go out in the not too distant future. And then beyond the traditional mail communications, I've already plugged our website. That's going to be where the freshest, most up-to-date information is. And then we've begun issuing an electronic newsletter called The Pulse.
No.
And The Pulse will have stories and features that have updated information, stories about your health, spotlights on benefits, such as
Great.
Teladoc or
Great.
other types of benefits that members may not be aware of. So going on to My TRS, creating an account there, signing up for our newsletter will be a great source of information for people to get up-to-date news about their health plan. And then beyond that, you've talked about our telephone number at TRS, which I think you're going to post.
We are.
And we're open Monday through Friday, 8 to 5. But the Humana call center that's specifically for TRS-Care, for our Medicare Advantage plan, is extending their hours, or has extended hours. And the call volumes have been up for all of our call centers. And their hours are 7 a.m. to 8 p.m.
Yeah, well, I really appreciate it. We had a member who was interested in extended hours. We talked about that, and y'all, jumped on that, and it was just, again, it shows the level of partnership and communication, and we're so grateful that we have this relationship with TRS that we do, that a suggestion like that can be put through and just handled immediately. So thank you so much for doing those things. Communication is just such a big part of this. So I know that we just talked about the website. We talked a little bit about My TRS, and I think if you've been paying attention to the TRS newsletter at all for the last, year and a half or so, maybe longer, you're starting to hear this My TRS a little more often. You all are making great progress on keeping member information safe. There's been a big, at the board meetings that we've attended, we've talked about TEAM, which is a project in maintaining and having good components electronically and just up-to-date systems to manage the TRS information. But My TRS is that personal connection that a member can have with their TRS benefits and with y'all in teacher retirement system. And so if you're a TRTA member, or just if you're a retiree watching this, you don't have to be affiliated with TRTA at all. But if you're a TRS retiree and you have not gone onto the website to get a My TRS account, we highly encourage you to do that so that you can get updated information, that you're not waiting on somebody else to forward you something, that it's coming directly to you. Is that kind of how that works?
Absolutely, and it's a great service not only for our retirees but for our active members as well. And it's a way for them to give us the contact information that we need to push information out to them in an electronic format. So just an email address and some other security features that hurdles they have to overcome to prove that they are who they say they are, of course. And then once we have that validation, then they can go and access information specifically about their account and about their coverage levels and so forth and so on. But then they can also sign up for newsletters so that we can push information out to them The Pulse will be a great source of that information, and so I would strongly encourage all of our members to get that account.
Good.
And for our active members, this is not necessarily, I don't expect many of them to be watching this, but if they are, it's a great source for them too, as they're planning their retirement or trying to get information about their account and what their benefit level could be. My TRS will be a great resource for that.
Wonderful. As well. I know that a lot of our retirees have a son or daughter who's still teaching, and so that's good news. They can pass that on to their family who still are in the profession. I think there are quite a few HR folks that watch this too. So that personal connection, whether you're active in the school system or you're retired now, TRS wants to make that connection with you so that you can get the information you need. Katrina, can you talk to us a little bit about where participants can get more information about premiums, individual coverage discussions, coverage for the retiree spouse, just very specific data? Where's the best place to go?
Right. Well, we talked about the website, and we will continue to update and refresh that information. So that's always going to be the quickest, easiest, most up-to-date place to get information. But I recognize that some people don't use the internet, fewer and fewer people, but there are some who still don't like to access their information that way. And we'll be sending out letters. They'll be coming out soon that will outline these changes. And then Brian mentioned face-to-face meetings that we'll be having across the state. We're going to send out in the mail invitations for those meetings as we get closer to the date. And then we also have recreated a newsletter that we had some years ago. We recreated it in the form of an electronic newsletter, so it comes via your email, called The Pulse. And in The Pulse, we have stories about benefit changes, how to use your benefits, how to maximize your benefits, how to stay healthy. And so I think that's a really good source of information. Members can get that by going on to My TRS, signing up for an account, selecting the newsletter, and then they'll get that newsletter routinely. And then members always have the option to call us at TRS. You're going to post the telephone number on the next to this videotaping, and we're available 8 to 5 Monday through Friday Central Time. And then Humana has extended their call center hours to handle the increased call capacity that we've been seeing. And so their call center is open 7 a.m. to 8 p.m. Central Time. And that is a call center that's specific for the TRS-Care Medicare Advantage plan. So when you call there, those counselors understand all of our features of our benefits, and they're ready to talk to members. So we have counselors ready to talk to members, eager to help them understand these changes. Change can be frightening, but getting the right facts, I think, is important to helping folks make the right decision. And you've mentioned this earlier. I think it's a really good point to make. We've talked about the plan year for the standard plan is adjusting from September 1st to January 1st, 2018. That gives members additional time to research, understand, make good decisions. No one has to rush into a decision here. Get all the facts, contact us, just understand what the changes are and how that compares to what anyone might buy in the marketplace, which I would think would be very different.
Yeah, so great answers. We're going to post those phone numbers for y'all to call, communicate with TRS, communicate with us, but always have the factual information from TRS about your benefits. And again, we just want to make sure that all of that information is available to you when you need it, while you're making a decision, but not having to rush into any decision. And you said it, and we'll restate it, is that we've typically started a new plan year in September with the start of the new state fiscal year. But y'all worked with the legislature, and they pushed that back to January 1st. So if you have questions about Medicare Advantage, about your benefits, it's not as an accelerated timeline as what we've normally seen. So take some time, get the information that you may need, and then make the decisions based on that information.
And can I make one other point,
Sure.
Real quick, Tim, that we haven't talked about yet, and I think this is a very important point. So we talked about the adjustment of the plan year date from September to January for the standard plan. Everybody who's enrolled in TRS-Care 1, 2, and 3 know they have deductibles and out-of-pocket expenses. Those do not reset at September 1st as they normally would. Everyone will have an extended plan year, and TRS, our fund, is going to just absorb those costs. That was an additional benefit that the legislature wanted to make sure that the members had, so that there was time for this adjustment. So that's important for the retirees to know, so that they realize they aren't going to have new deductibles, new maximum out of pockets beginning on September 1st if they're in our standard plan. Those amounts will not reset until the new plan year and the new plan structure that we've been talking about.
Good. So that's going to save our folks a little bit of money before
Quite a
we
bit.
start the next plan year.
That's
So,
right.
okay, so we know not everyone will find the right fit. I mean, just some folks may not. They may choose to leave. They may, look at this from a different perspective. If I'm under age 65 and I may have access to some other health insurance, so there's been discussion during session, and then there's been, kind of some discussion now about why it's so important to wait and make the best plan decisions. Because a lot of times we're talking about this health insurance. If you leave, you may be gone, and so there were some adjustments made for the pre-65 population. There's components of this, and I'm going to reiterate again, depending on where you are, always talk with TRS before any decision point gets made. But Brian, I know that as the legislation evolved, we just, there were some circumstances that we thought if you're under age 65, you may have a different alternative, and you may want to have access when you turn 65. So can you just give us some of that background and then help us understand how to connect with you again, so that as people make those decisions, they know what their windows may be to come back, or if those windows and doors are just going to be closed if you decide to
Sure.
leave.
Well, that's a great question, Tim, and it's a very important piece of the communication effort that we're going to have. We know that the changes, particularly to the pre-65 population, are substantial, and that could have a significant impact on some of our members' life choices and their finances, and they have to take all that into account as they're making a good informed healthcare decision. Right now, under the current rules, if a member elects not to disenroll or to cancel their TRS-Care coverage, there is no option for them to get back in. That being said, that is going to change. And so effective January 1st, 2018, at the legislature's direction, being sensitive to the significant changes that were being made, if a member elects to not receive coverage under the TRS-Care standard plan as a pre-65 retiree, once they reach the age of 65, they can re-enroll in TRS-Care and take our Medicare Advantage plan, effective January 1st. Now, between now and then, the current rules still apply. But moving forward, and again, we don't want to encourage any member to make a hasty decision about this. They need to look very carefully about the plan options they have in front of them and make the best choice for them. But if they do, for whatever reason, elect not to take the pre-65 coverage, they will have one opportunity when they turn 65 to opt back into our plan.
So the most important thing that you said in that whole discussion is know how it affects you, because they could be irrevocable decisions. TRS has a great staff. Your team is ready and willing to answer a lot of questions. It is just so important to know what your options are before any decision gets made. And we've been talking about this for years. Even when you're thinking about, if you're not yet retired and you're thinking about getting your paperwork in just for retirement in general, you need to be talking to a TRS counselor. So it's your retirement questions, your healthcare situation discussions. These are the folks that have the information that you need about your decision. And again, while any family member or friend may be well-intentioned, we just encourage you to talk to TRS about what options you have available to you. for all of your TRS related decisions. So, and this is a big one. So, Brian, I appreciate that discussion. So, we know that we're not going to be able to answer all of your questions in this forum. Today, we have just wanted to focus on the actual implementation process of the health insurance program as it is changing from this last legislative session. So many of the questions that we get at TRTA, and I'm sure at TRS, have to do with my doctor is saying that they won't take it, or I don't know if this is going to work for me because of these circumstances. And so our goal today was to set you on a path to get the right information, to also say that information is coming, that TRS is working diligently to provide you with the factual data that you need to make the best decision. It was not a policy discussion. We know that some of you do have lots of policy questions that you want to ask TRTA specifically, and we're happy to answer those. But I'm going to kind of ask for a kind of a closing word from both Brian and Katrina. And, and Brian, maybe you can start off by touching on this idea that the healthcare market's changing. For us to think that this will be the last time that this healthcare plan may change, I think that we just see what's happening nationally to know that it's always changing. And so, I'm interested in kind of just your opinion, not a matter-of-fact statement. I'm just looking at the trends of healthcare costs. As we get, into this and we kind of start moving into the future sessions, do you see these trends of costs still going up and that we're going to have to continue to focus on this issue?
I do, and I think that's a very important point. All the work that was done this legislative session was extremely important for the long-term sustainability of these programs, but it's not the final word. And I fully anticipate, given the increasing cost of healthcare, which is beyond our control in many cases, we're doing everything that we can at our level to try to control those costs. But there are national trends that are beyond our control that are going to continue for the foreseeable future. And as they do, we're going to have to revisit this program. And I made it very clear during the legislative process to educate our elected officials that this is not the last bite at the apple by any means. We are going to be coming back probably next session and talking about this issue again. And I would anticipate talking about it at the session after that. This issue it's important. And it's vital to our members, but we can't stop talking about it because the issue is just going to continue.
Yeah. Katrina, any last words that you want to provide to our folks watching?
Yes, I would, and thank you for having us. Brian sort of answered that question at the macro level, and I'd like to take it to the micro level. So what can retirees do? And as Brian said, we do as much as we can with our funds to help manage the cost in our health plan so that we can extend the benefits further to more people at a lower price. But it's important that our retirees and their families understand how to use their health benefits. And so what I would say to everyone is, if you're healthy, stay healthy. Do what you can. Participate in our wellness programs. We've talked about some of those today. There are opportunities for you to stay active and engaged, and if you can, stay healthy. If you have to access healthcare services, be sure that you go to an in-network provider. Going in-network, and we talked a lot about the difference in the Medicare Advantage plan, so there's a difference there, but for the most part, going to an in-network provider is very important. Those are doctors and hospitals that are chosen by our health plans, not just on cost, that's a piece of it, but also on quality. And so when you go to an in-network physician or hospital, you're saving yourself money and you're saving our health plan money. And then finally, if you have a chronic disease that you're managing, do what your doctor tells you. Take your medication, get your refills, take the medication, manage your disease to the best of your ability. Again, you will feel better. It will save you money in the long run, and it also saves our health plan money. We primarily have a self-funded plan, so we are trying to manage the funds, again, to extend the benefits as far as possible, and our retirees and their families are part of that equation in helping us manage those costs.
Yeah. Well, again, I want to say to both of you, thank you for coming today. We were all so vested in our members in trying to get the best possible outcome. And there were moments where I wondered if the death spiral was going to occur, and none of us want that. Everybody who worked in the legislative process, I know, has a good intention to finding the best possible solution so that you have affordable health care that you can access and that serves your needs. And so we're going to continue to work on that. We're going to continue to work on this from lots of different levels. But today, we know that the changes are going to be implemented and that we're counting on our friends at TRS to give you the best counsel they can to make the best decisions for you. And we know that you're going to have more questions. Please feel free to contact us via email, log on to our Facebook page. You can use Twitter to send us questions through that as well. I know TRS is also in the Facebook world and is on Twitter, and you can contact them through their various communication sources that we're going to put links to in our video. Again, thank you for your time. Thank you for your questions and your patience. Brian, again, thank you so much for all that you do for TRS and the members that you've served, both active and retired. Katrina, I just know that you're a passionate advocate for good health and good service to the members at TRS. And so thank you for what you do to our members and helping them get the best options they need for this health insurance program. So thank you so much to both of you.
Well, and thank you, Tim, for having us today. And we look forward to continuing to work with you and with everyone as we make these important changes.
Great. And with that, thank you so much for your time, and we're glad to help you in any other way possible. Send your questions, and we'll do our best to answer them. Thank you much, and have a great day.